In this video we will see the following points: the definition of hemophilia, types of hemophilia, the causes, symptoms and complications, the diagnosis, treatment and prevention. Definition of hemophilia. Hemophilia is a rare disorder in which blood does not clot normally due to a deficiency of proteins needed for blood to clot, clotting factors. If you have hemophilia, you may bleed longer after an injury than if your blood clots properly. Types of hemophilia are two types. Hemophilia A, it is also known as classic hemophilia because it is the most common. In this disease, clotting factor VIII is absent or its quantity is reduced, and hemophilia B, also called Christmas sickness. In this disease, clotting factor IX is absent or its amount is reduced. Hemophilia is a genetic disease. It is passed from parents to their children. In some rare cases, a child may be born into a family with no history of hemophilia. This can be explained if a history of hemophilia has gone unnoticed in the family or by the appearance of a new random mutation, abnormal change, in genes. The causes of hemophilia. Hemophilia is caused by mutations, abnormal changes, in the gene that produces clotting factors VIII or IX. These genes are located on the X chromosomes, sex chromosomes. Chromosomes are small structures found in every cell in the body, except red blood cells. It contains our genes. Genes determine the different characteristics of our organism, our appearance, and the different functions of our bodies. Chromosomes are grouped in pairs. Women have 2 X chromosomes and men have 1 X and 1 Y chromosome. Only the X chromosome contains the genes that make it possible to produce clotting factor. A man who has an abnormal gene, the hemophilia gene, on his X chromosome will have hemophilia. A woman must have an abnormal gene on each of her X chromosomes to have hemophilia. If a woman has the abnormal gene on only one of her X chromosomes, she is a carrier of hemophilia. Usually, she does not have signs and symptoms of hemophilia, but she can pass her abnormal gene on to her children. Symptoms and complications of hemophilia. The main signs and symptoms of hemophilia are excessive bleeding and easy bruising. A person with hemophilia does not bleed faster than other people, but may bleed for a longer period of time before a clot forms. The amount of bleeding depends on the severity of the hemophilia. Bleeding from external injuries is usually not serious. Examples of external bleeding include 1. Heavy bleeding is not a minor wound, 2. Bleeding in the mouth after a cut or bite, 3. Nose bleeds for no apparent reason. Internal bleeding is more serious. Examples of internal bleeding include 1. The appearance of large bruises resulting from bleeding in the large muscles, 2. Blood in the urine or stool due to bleeding from the kidneys, stomach, or intestines, 3. Bleeding in the knees, elbows, or other joints that may occur for no apparent reason. The joint may become stiff, painful, swollen, or hot. The signs and symptoms of hemophilia A and hemophilia B are the same. The only way to find out what type of hemophilia you have is to have special blood tests. It is important to know what type of hemophilia a person has because the choice of treatment is different. Diagnosis. People with severe hemophilia can develop bleeding problems at a very young age and are often diagnosed before they are 1 year old. People with less severe hemophilia may not be diagnosed until they are older. Hemophilia is usually diagnosed by noting abnormal signs of bleeding, looking at family history, and using blood tests. Blood tests are used to determine 1. The time it takes for blood to clot, 2. Blood clotting factor levels, 3. The possibility that a clotting factor is partially or completely missing in the blood. The test results will help confirm whether you have hemophilia, what type of hemophilia you have, and how severe your condition is. Hemophilia is called mild, moderate, or severe depending on the amount of clotting factors VIII and IX in the blood. In pregnant women who carry this condition, doctors may perform a test before the baby is born to diagnose hemophilia. The doctor then performs a trophoblast biopsy or amniocentesis. A biopsy of the trophoblast, the tissue that envelopes the fetus, can be taken as early as the 10th week, while amniocentesis is performed after the 15th week. Treatment and prevention. The type of treatment varies depending on the type of hemophilia, the severity of the disease, and your daily activities. It will also be different if you are having dental or medical procedures. The main treatment for hemophilia is clotting factor replacement. Factor 8 or 9 is injected into a vein. These clotting factors can be produced from human blood that has been filtered and treated to prevent viral infections. Thanks to modern technologies, the risk of contracting an infection through the infusion of clotting factors is very low. Clotting factors can also be produced in a laboratory rather than taken from human blood, these then recombinant clotting factors. Replacement therapy can be given prophylactically, which is a regular administration to prevent bleeding, or on demand, only when a bleeding episode has occurred. Possible problems associated with clotting factor replacement therapy include 1. Formation of antibodies that attack the clotting factor, 2. Development of acquired viral infections after injection of clotting factors made from human blood, 3. The appearance of damage to the joints, muscles, or other parts of the body due to the delay in treatment. It happens, very rarely, that the organism forms antibodies which attack the replacement clotting factor and which thus prevent the treatment from being effective. These antibodies are also called inhibitors. In hemophilia A, antibodies can be found in about 20% of people treated, while in hemophilia, they can be found in 1% of people treated. It is found most frequently in patients with a severe degree of hemophilia. Doctors may use a higher dose of replacement therapy in these cases. Other treatments for hemophilia include desmopressin, DAP. Desmopressin is a synthetic hormone used to treat light bleeding in people with hemophilia A. It causes the body to release more factor 8 and von Willebrand factor. Von Willebrand factor helps keep factor 8 in the bloodstream longer. DAP can be given as an injection or as a nasal spray. It is only used in certain situations because its effect may wear off if given too frequently. Tranexamic acid. Tranexamic acid belongs to the class of medications called antifibrinolytics. These drugs prevent the breakdown of blood clots. It can be used with clotting factor replacement therapy as a tablet or as an intravenous injection. It is usually used before a dental procedure or to treat bleeding from the mouth. Gene therapy. Researchers are trying to find ways to fix the abnormal genes that cause hemophilia. Gene therapy is not yet commonly used, as more research is needed.